You will hear a consultation between Dr. Alan Foster, a neurologist, and Mrs. Evelyn Harper, a female patient in her mid-50s. They're discussing symptoms related to possible multiple sclerosis. You have 30 seconds to review the notes. Hey, good morning, Mrs. Harper. Nice to see you again. I can see from your referral that you've been experiencing some neurological symptoms. Tell me more about these.
Oh, hello, doctor. Yes, over the past several months, I've had episodes of extreme fatigue. I'm not just talking about being a little tired either. It's more like my body feels completely drained, even after a full night's sleep.
Ah, I see. And has the fatigue been continuous or does it kind of come and go?
It's intermittent. Some days I feel completely normal, and then out of nowhere, I get so exhausted that I can barely function.
Okay, that's pretty important. Have you had any other kinds of symptoms?
Oh, yes, actually. I've had this strange tingling sensation in my hands and feet. At first, I thought it was just, poor circulation, but it's happening more frequently. Also, a few weeks ago, I had difficulty moving my right leg. It felt weak and uncoordinated. It went away after a few days, but it was really frightening.
I bet that was concerning. Did you notice any changes in vision, such as blurriness or double vision?
Yes, now that you mention it, about a month ago, my left eye became blurry for a couple of days. I thought maybe I was just tired, but it was different from normal eye strain.
Oh, thanks for sharing. I'd like to explore these symptoms further. Have you experienced any dizziness or maybe loss of balance?
Occasionally, it's not all the time, but I do feel unsteady sometimes, especially when I stand up quickly.
How about any changes in bladder function? For example, increased urgency or difficulty controlling urination?
Actually, yes. I've noticed that I sometimes feel like I urgently need to go, but then I don't always pass much urine.
These are all symptoms that suggest a possible neurological disorder, potentially multiple sclerosis. MS is a condition where immune system mistakenly attacks the protective myelin shelf sheath around nerve fibers, leading to communication issues between the brain and the rest of the body.
I've heard of MS before, but I didn't think it could start like this. Is there a specific test for it?
Yes, the main diagnostic tool is an MRI scan, which can detect lesions in the brain or spinal cord. We may also perform a lumbar puncture to analyze cerebrospinal fluid for specific markers of the disease. Additionally, evoked potential tests help assess how well electrical signals travel through your nervous system.
Wow, that sounds quite involved. What happens if the tests confirm MS?
If the diagnosis is confirmed, we'll discuss disease modifying therapies that can slow the progression of MS and manage symptoms. These include immunomodularity drugs, corticosteroids for acute relapses, and physical therapy to maintain mobility and function.
Is there a cure?
Unfortunately, there's no cure for MS. But with the right treatment plan, many people manage their symptoms effectively and maintain a good quality of life. Early intervention is key.
Okay, I see. Are are there lifestyle changes that could help?
Oh, of course. Maintaining a balanced diet, regular exercise, stress management, and no smoking. These are all beneficial. Some studies suggest that vitamin D might play a role in MS progression, so we'll also check your levels.
Okay, thank you, doctor. I appreciate your thorough explanation.
You're very welcome. Let's get your MRI set up and we'll discuss the results once they're available. In the meantime, if your symptoms worsen, don't hesitate to contact me. You now have 2 minutes to complete your answers. Be sure to check out our other videos. We're posting new ones almost daily.